My name is Rori Harris-Killough. I am a patient market and experience manager here at Providence. I've been here 15 years. Today, I am meeting with Jitka. It is December 5th, 2023. And Jitka, would you like to introduce yourself?
Hi, my name is Jitka Prokesova. I am a nurse. I am manager of Orange County High Desert CDI team. I have been with Providence. Next month is going to be 19 years. I am currently located in Connecticut. I work remotely.
I failed to mention, but I am in the Pacific Northwest in Oregon. Jitka and I met earlier this year. I wanted to bring you here to record something today because through getting to know you, I got to hear a little bit about your nursing story. I'd love for you to tell me about it.
If I begin at the beginning, I became a nurse because I was a patient. I was 12 years old in a hospital with appendectomy, and I had some nurses that were really great nurses, and I had some nurses that were not so great nurses. And I decided I wanted to be one of the great ones. So I went to nursing school, 4 years of nursing school, and then I worked for 2 years. This was all in Communist Czechoslovakia. I graduated in 1985. After 2 years, I defected. And when I came to United States, I thought with my 4 years of nursing school and 2 years of experience that the State Board of Nursing would allow me to take the state board exam and allow me to work as a nurse. But their question to me was if we had a refrigerator and if I knew how a tape recorder works. And I was thinking, oh boy, I have some work cut out for me here, trying to convince people that somebody from behind Iron Curtain actually can do nursing. I actually went to library and I took some aptitude tests to see what other things I could do if I cannot be a nurse in the United States, what else I could do. And they came out and told me I could be a photographer. And I was thinking, great. I think the only things that I ever want to take pictures of professionally would be probably patients' wounds. So I said, I'm a nurse. I need to go back to nursing school. So I went back to nursing school. I went to school in Southern California and I graduated for the second time in 1995. And I was so happy. I've had moved around a little bit. I worked on telemetry in ICU and CCU, interventional radiology, endoscopy, informatics, and now I work in clinical documentation integrity.
That's such a story of persistence and resilience. Jitka, how did it make you feel when you came to the United States and they gave you those really culturally insensitive questions?
Well, I was thinking they just don't know what our healthcare was like. They probably imagined we worked in a cave. I've read the horror stories about people working in some conditions where they had one needle for the whole hospital and they reused it. I knew that they didn't know anything about what our nursing was like. We had to improvise a lot. I learned to do without and figure things out and be resourceful.
Do you think that made you a better nurse?
I think what made me better nurse was, interestingly, in the United States, nursing is taught by nurses. In Czech Republic, in Czechoslovakia, nursing was taught to us by physicians. They taught us from a different perspective. And there is not as big of a delineation between what nurse can do. Well, back in my day anyway, I've been in this country for 35 years, so things may have changed. But back then, I could do, as long as the physician allowed me to and supervised me, I could do things that I couldn't do here because there is very strict delineation what a nurse can do, what a CNA can do, what a physician can do. And then when I came into United States and I went to nursing school, and there was like, if you see this, you have to report that. You cannot go and do something about it. So I think that it made me a better nurse, understanding when I was going to physicians to report something. It is so different in the United States. Nurses in here educate patients. We were not allowed to educate patients. I could tell patients what blood sugar they have or what blood pressure they have. Back then, I wasn't allowed to tell them what medications I'm giving them. It was very difficult to gain patients' collaboration when they didn't know what and why. And in the United States, you get to do that. So I think that's better. Coming to the United States, I had to, in nursing school, I knew the medicine, I knew the pathophysiology. I didn't need to learn that. What I needed to learn a lot was patient education because that really intimidated me.
Sounds like you had a really well-rounded experience. As you were talking and you were talking about already knowing what the physicians needed from you, I thought, wow, Jitka, you must be the best at SBAR and giving a recommendation than anyone else we ever met.
Oh, I don't know about that, but I do pretty okay, I think.